Low monthly premiums and specialized health care for seniors are just some of the promises of Medicare Advantage. But some are now warning about frequent denials of care and fewer provider options, leaving a vulnerable population without care or facing thousands of dollars of debt. We're covering all sides in our special report, Medicare Disadvantage, only on KRDO 13. At least half an hour every day, Diane Dunn does physical therapy inside her Denver home. Back in July of 2022, a driver illegally turned in front of her, and the impact nearly killed her.
The hood comes up into the windshield, and the dash or the under dash, it collapsed and pushed into my legs and scraped up. So it cut me really bad.
She went home after 12 days in the hospital, then went back for skin grafts to repair the damage. But just a few days after that surgery, she was told it was time to check out.
And I said, I'm still bound to this bed. I am not allowed out of bed. How can I go home? And they said, well, Medicare is saying, they're not actually saying that you have to discharge. It's just that they will not pay for you after 3 days from now.
After a series of appeals, Diane got the care she fought for, but always felt like her Medicare Advantage provider really wasn't working for her.
Was my health and well-being the priority of United Healthcare? No, absolutely not.
United Healthcare couldn't comment on her case, but in a statement to KRDO 13 said Medicare Advantage enrollment has doubled in the last decade because of the incredible value it delivers for members. Compared to original Medicare, Medicare Advantage plans offer broader coverage and benefits, drive better health outcomes, and higher consumer satisfaction. Traditional Medicare for those 65 and older is managed by the federal government. Medicare Advantage is offered through private companies.
The purpose of healthcare in this country is to maximize profit. And a major way that they do that is by denying care.
Retired physician Dr. Madeline Jacobs practiced in the city of Florence for 30 years and believes Medicare Advantage created unnecessary obstacles for both her and her patients.
Very often they could not see people that I recommended they see, and the billing was much more difficult. For Medicare, you send it to Medicare, you send it to the GAP plan, and we had way less problems than we did with Medicare Advantage programs.
It's important to point out that a lot of people are very happy with their Medicare Advantage plan, and surveys have shown that the overall satisfaction level is just about the same as with traditional Medicare. For most people, Medicare Advantage offers lower monthly premiums, a less complicated system, and frequently includes extra benefits beyond what traditional Medicare does. But those with Medicare Advantage do report far more denials of care. They often have to stay within their network to avoid extra fees, and they frequently need prior authorization from the company for a particular test or procedure.
There's pros and cons to both sides of them.
Marcia Murill is a Medicare broker in Colorado Springs. She compares all Medicare options to find seniors the best plan and admits that all the different costs and coverage plans can be overwhelming.
You need to sit down with somebody that will take the time to explain to you.
Lift it up.
Diane believes many seniors go with the Medicare Advantage plan based on aggressive marketing and false promises.
They were saying, ooh, here's all these great things. We'll take care of your drugs. We'll take care of all these things if you're ever in the hospital or in rehab. And then they didn't really come through for me on that.
It's outrageous.
Just last fall, lawmakers in Washington discussed the way seniors are often preyed upon by Medicare Advantage marketers.
Marketing middlemen.
16 months after the accident that left her scarred in more ways than one, Diane hopes seniors and their families will do their homework or find an advocate to help them and fight on their behalf when they need help the most. If you are having second thoughts about your Medicare Advantage plan, there is a window to change your mind, and the deadline for that is March 31st. Right now on KRDO.com, we have lots of additional data and guidance, including some very concerning comments from several hospitals right here in southern Colorado.